Hi, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks. Thanks for tuning into H&HN Daily's Executive Insight Series. Advanced illness management is becoming a critical focal point for hospital leaders as they try to improve population health and care coordination. The AHA Board's Committee on Performance Improvement recently issued a white paper on the topic and is working on a toolkit of best practices that will be released to the field later this year. I'm joined today by Jim Diegel, President and CEO of St. Charles Health System, to talk about the toolkit, the guide, and advanced illness management. Jim is also chair of the Committee on Performance Improvement. So Jim, thanks for joining me this afternoon.
Oh, you're welcome.
Can you give me a little bit of background on the Committee on Performance Improvement and why the board decided to set this up and what your mandate is?
You bet. The Committee on Performance Improvement was actually created for the 2011 calendar year. And so they had a committee that was put together. It was chaired by Jeanette Clough from Massachusetts, and they focused their first year's efforts on the report that was published late last fall called Hospitals and Care Systems of the Future. And this year's focus is really been on defining and taking a look at advanced illness management, which is a broad term that describes how do we help people manage advancing illnesses and chronic illnesses and palliative care and end-of-life care.
And so advanced illness management is really, advanced illness is really that stage, right, where a disease has gotten to the point where end-of-life care is what's going to kick in. Is that right?
Could be. Actually, there are a variety of phases when we define advanced illness management. So one phase might be a more traditional episodic or curative type of treatment. So it might be that you have a life-threatening illness or a serious illness, but intervention has allowed you really to recover, and so your prognosis is really great. And then maybe a second phase is around the development of a chronic disease state, but it's pretty manageable. A third phase is, you have more complications with a chronic disease state, and you're starting to move toward some type of an endpoint in the human existence. And then the last phase is really more end-of-life care, in particular, i.e. hospice as well.
So Jim, where is the field in terms of advanced illness management? Where are the holes in the system? Where is it working right?
So what we're finding is there's tremendous variation around the awareness of advanced illness management across the country. There are some systems and organizations that have really got it together and it's pretty sophisticated and very well coordinated. Some that are beginning the journey and some that have not really begun the journey yet. So our first focus on the research and on best practices in that, and really the theme of the first edition that you're seeing of the report is around how we access advanced illness management services, how we define it, and how we access those services. The second part of the report that you'll see later at the end of the year focuses more on how do we educate and train the workforce to manage that. And then last, but probably most important, how do we increase the awareness around advanced illness management, not particularly in our organizations, but also with the patient populations and in the community at large.
And the first report that's out, talks about shared decision-making between providers, family members, patient, care coordination, the care continuum. You reference this idea of the workforce and training. Are we at the point where the health system and the academic system are training clinicians for this environment?
Well, I believe that clearly there's awareness around that, and the AHA has been focusing on this particular topic, whether it's professional workforce development or how do we build team-based care programs that bring together a variety of caregivers, whether it's a physician or an allied health practitioner or a nurse or other licensed professional and or non-licensed professionals and new types of roles that are emerging like care navigators or community health workers, etc., and or other new jobs that we maybe haven't even invented yet today. I am seeing that this awareness around team-based care and interdisciplinary care is emerging organically within organizations as everybody understands this is where we need to go. And I'm also seeing in some of the training institutions that awareness there.
And so one other thing the paper notes is the challenge that smaller and rural hospitals may have in this area. So what are your concerns for those parts of the field?
A very valid question, and my career got started in the rural markets. Our health system of the 4 hospitals, 2 are critical access hospitals, 1 is a 50-bed community hospital. I think 2 thoughts on that, and these are really more my personal opinions. Number 1, I think critical access hospitals and rural hospitals need somehow to forge collaborative working relationships with larger systems. To continue to just be completely independent and expect to be able to do everything that a larger institution or organization can do is wishful thinking. So finding a way to collaborate with larger systems, I think, will be key. At the same time, larger systems have responsibilities to look out for the needs of the populations in the rural areas and to assist rural organizations with the resources and the talent and the systems to help them deliver their care that's appropriate to be delivered locally. I feel very strongly about that. But I think the key takeaway is people need to talk and that alignment needs to occur and relationships need to be had.
Great, Jim. I appreciate you taking some time today.
You're very welcome.
I'm Matthew Weinstock. Thanks for tuning in to H&HN Daily.